From high fives to taking the dog on a walk around the neighborhood, our arms, legs, hands, and feet are important to our daily lives. They allow people to work, live, and thrive. The average person is born with 2 full arms and 2 full legs. In fact, about 99.94% of the people in the United States are born this way. That does leave 6 in every 10,000 babies born missing at least part of one of their upper or lower limbs. In addition to those born with an amputated portion of their body, there are many who suffer from disease, trauma, or cancer who undergo a procedure to amputate their affected limb. According to 2015 Congressional Research Service report, there were 1,645 major limb amputations in the years of 2001 to 2015 in the U.S. military. 54% of lower limb amputees in the U.S. suffer from a vascular disease such as diabetes, leading to the need for amputation. Nearly 2 million people in the United States alone are living with limb loss, and this is not including the 0.06% born with congenital amputation. The advancements in amputation procedures and prosthetic technology have opened up extraordinary opportunities for amputees both in the United States and abroad. The countless resources and medical expertise offered enable individuals to live a quality of life unimaginable until the 20th century. Many of the amputation cases known of throughout history were from horrendous battle wounds. However, because of the lack of antibiotics, any wound could become very severely infected with a flesh-eating disease such as gangrene, making the amputation the only treatment option to save the individual's life. Back in 400 BC, it was common practice to amputate through the infected area, but this would not remove the infection and further amputation was often required. In the 1st century, skin from the amputation site was retracted toward the midline of the body, the bone was cut, and the skin was allowed to grow back down to cover the residual limb. In the 1700s, a new technique was employed, involving using a flap of skin to cover the open amputation site. This provided a well-protected environment to prevent against infection. These variations in surgical developments only addressed how to repair the skin around the amputation site. Surgeons also needed to determine the best way to reattach muscle, nerve endings, and reroute blood vessels to ensure the health of what is referred to as the stump. The importance of the speed of amputations was critical because without advancements such as anesthesia and tourniquets to stop excessive bleeding, individuals would die on the operating table from either physical shock or too much blood loss. In the late 1800s, just prior to the Civil War, the use of anesthesia became common practice and allowed surgeons the time at the operating table to make improvements on the procedure and begin applying antiseptic practices. In the 1800s, as the Civil War broke out, researchers were overwhelmed with the high mortality rate of post-operative amputees in the hospital. Even after removing the infected tissue, patients were often contracting new infections while recovering in the hospital. The lead bullets of the Civil War did significantly more damage than the weaponry of centuries past, and the cases of septic shock ran rampant. Amputation was excruciating and risky, but due to the high demand on the battlefield, surgeons had no choice but to operate in order to save these men's lives. Anesthetics, along with pain-killing and nerve-numbing drugs such as morphine and cocaine, were used only long enough to perform the amputation. World War I was a war fought in the trenches. These hours in the trenches provided a perfect breeding ground for infections such as gangrene. Once again, many soldiers were faced with the necessary amputation. At this time, many new amputation innovations were adopted, and pivotal advances were made prior to the Second World War. Alexander Fleming discovered the first antibiotic, penicillin, in 1928, and within 12 years it was mass-produced. Just about a decade after Fleming's revolutionary discovery, sulfonamides became another available medication to treat bacterial infections. These advancements in anesthesia, pain management, the treatment and prevention of infection have made amputation a much safer practice. The purpose has been switched from simply a gamble to save a life to being the opportunity to provide thousands of people with a quality of life. The amputation procedure is still a high-risk surgery to perform, but with all the improvements made over the past century, the thoughts of healthcare providers can move beyond the operating room. In the mid-1940s, a group of medical professionals were given the task of developing improved prosthetic technology. Within the next 5 years, medical professionals from across the nation and across the world collaborated and developed better prosthetic joints, post-surgical practices, and more extensive research groups. Prosthetic limbs were not a new concept in 1945. The oldest known example of a prosthetic leg has been dated back to 300 BC. It was made of wood with a bronze and iron outer layer. Prior to the U.S. research project, however, the prosthetics were not designed to enable the use of a residual muscle. A prosthetic leg developed in 1950 by the University of California, Berkeley, provided a new socket design allowing for a more natural fit and potential function for the amputee. Prosthetic legs that were once fabricated using primarily wood and leather are now often made with a plastic material called polypropylene and a lightweight metal such as titanium. Prosthetic legs were once attached with suspenders, a waist belt, or a thigh corset. They are now attached to the body through suction, providing a comfortable fit and versatile usage. The prosthetic technology available today includes legs, hands, arms, knees, and feet. There are even bionic arms able to exercise complex motor skills controlled by the human mind. This complex prosthetic is not widely available due to its expense, but continued research is being done across the United States to enhance the quality of life for amputees. Due to the advancements in medicine and biomedical engineering in the last century, there is greater hope for the amputee, decreasing the risk of infections and treating infections with antibiotics, using anesthetics, increasing survival rates, and other practices with the prosthetic technology. Amputees are now able to live a normal life. They can dress themselves, cook meals, and stroll with their loved ones once more. They can run marathons, swim laps, and dance with their daughters at their wedding. The difference in quality of life between amputees 100 years ago and amputees today are monumental, and there are even more advances to make in this area of healthcare.